Good morning, Chicago. I'm Dr. Allison Arwady, the Commissioner at the Chicago Department of Public Health. Today is Thursday, April 15, and as always, this is your chance to get your questions about COVID answered directly. You can follow along on Facebook, on Twitter. You can put questions directly into the box below, or you can use the hashtag AskDrArwady, and we'll be taking your questions live in just a moment. As always, we'll start with a quick update on our data. So you can go to chicago.gov/coronavirus as the landing page for everything related to COVID. If you want to look directly about things related to vaccinations, chi.gov/COVIDVax, or if you want to get to the data dashboard, which is where we'll start here, chi.gov/COVID-. So as we take a look, we are continuing to see numbers on the increase here in Chicago. And as I mentioned on Tuesday, we've seen some slowing in that rate. And I am going to show some data in a minute because we got some good questions in about what are hospitalizations looking like, and I pulled a little bit of data to show you. But we're at a 5.8% positivity today. A week ago, we were at 5.2%. As a reminder, we really want that number back under 5%. The positivity number is as much a reflection of testing as it is growth in cases. And in fact, our testing numbers, as you can see, are increasing, which is what we would expect. When more people have COVID and more people have symptoms and more people have exposures, we would want more people to get tested. And so we're doing 13,845 tests per day on average. That's up about 3% from a week ago. But in comparison, our cases are at 722 a day, which is up 17% from a week ago. And so if we put all that together, we see that our outbreak is continuing to grow. It is not all being driven by testing. It is being driven by an actual increase in cases. And that positivity rate of 5.8 tells us that we are still doing a good job of testing a lot of Chicagoans. And I want to encourage anybody, especially with a lot of COVID here, if you're having COVID-like symptoms, reminder, you need to stay home when you're sick and you need to get a COVID test. There's information on the website. It's increasingly easy to get a COVID test. We've got free sites all over the city. You can order, if you're insured especially, but even if you're not, free of charge, COVID tests that can be sent to your home overnight. There's information about lots of ways to get tested if you're not sure, but we don't want people having potential COVID symptoms and not getting tested. We are averaging 3 deaths per day, which is exactly where we had been over the summer. And I'm going to pull up, just based on some of the earlier questions that had come in, a few of these. Let me just go to the slideshow here. Just a little sense of what some of this looks like over time. So this is our outbreak over time related to cases. And you can see that most recently, we are definitely back on the increase. Not like we were at the peak of November, where our average was up to about 2,500 cases per day. So 3.5 times what we're seeing now. And we had occasional days over 3,000. But definitely, on some increase, although you can see there's been some flattening. And we had some questions about what's driving this. Younger adults is very much who we continue to see the majority of these cases being diagnosed in. The red line here are 18 to 29-year-olds. And what you see is that over the last week and a half, still the most cases in 18 to 29-year-olds, but you see that's been flattening a little bit. So that's a sign, I think, of some progress, where really appreciate, some younger Chicagoans who maybe are being a little more careful than they might have been, or being careful in terms of not being in contact with those who may be at higher risk. But we are still very much seeing increases, people in their 30s in blue there, people in their 40s, followed by 50s. We're seeing some increases now in children, too, in the 0 to 17 age group, although they remain very low compared to those more working age adults. And then at the bottom, green are people in their 60s, gray are people in their 80s, pink are people in their 70s, and you can see those remain nice and flat. So it's been really good compared to the prior surges where those increased a lot. We're seeing the good effects of vaccination there. By race ethnicity, we are seeing, as you can see, increases across all the major race and ethnic groups in Chicago. Red here is white Chicagoans, and really throughout this third increase, we had seen the highest rates in white Chicagoans, and you can see that has actually flattened out a little bit as well over these last couple of weeks. And right now, red represents white Chicagoans, purple is black non-Latinx Chicagoans, blue is Latinx Chicagoans, and green is Asian non-Latinx Chicagoans. And they're all relatively equal at this point related to the increases, but we are seeing more increases, steeper increases, just over this last week among both black and Latinx Chicagoans. So again, a widespread outbreak, really needing people across the city being careful, wearing the mask, socially distancing. If you're gathering without a mask, you got to make sure everybody's vaccinated, fully vaccinated, 2 weeks post that second dose. And if there are people at high risk, continuing to be cautious there. Here's what hospitalizations look like for Chicago residents. So you can see they're on the rise for sure, but relatively low compared to either the first peak or the second peak. And if we look across the whole city, this is from a couple of days ago, but we've not seen some significant changes. We're averaging about 330, 340 people hospitalized across all Chicago hospitals with COVID, not in the ICU. And that's compared to 1,200 to 1,400 at our prior peaks. And ICU, we've got about 110 or so in the ICU compared to about 300 and 500 at the peak. So again, not concerned at this point about overwhelming healthcare capacity, but keeping a close eye. And then deaths look like this. So at our first peak, we were averaging almost 50 deaths per day from COVID, just in Chicago residents. At the second peak, we were up over 25 deaths per day, almost 30 per day, just in Chicago residents. And you can see right now we're where we were over the summer, averaging 3 to sometimes 4 deaths per day. Our efficiency goals continue to look really good. The epidemiologists were just running this yesterday. 97% of our allocated doses here in Chicago have been distributed. We have met that goal every week since we've started, getting at least 95% of the vaccine out the door. Obviously, with the pause on J&J, that put us in a little bit of a sticky situation because we did not have Pfizer or Moderna doses on the shelf in terms of being able to easily just switch things over. But we've been doing a lot of movement to be able to, we can meet those, and I'll talk about that. But we're doing really well on efficiency, and similarly, on our goal of getting vaccine into arms, 91% of Chicago's doses were administered and reported within a week. Again, exceeding the goal like we have every week of 85% or more. And again, most states and other jurisdictions across the country, this tends to be in the 70% to 80%, in some cases even down in the 60% range. And I'm really proud of the fact that just as soon as the vaccine gets here to Chicago, we get it out and we get it into arms. Here's what's happening with our mobile vaccination efforts. Most of these already were, this is not the homebound. These are when we're going to employers and we're going to long-term cares and we're going to workplaces and shelters. And we have, for the most part, we're not using Johnson & Johnson here. Where we are needing to make that switch, of course, we're doing it. But just highlighting that there continues to be a lot of really strike team-based work across the city and that it's growing. And then the last thing I just wanted to highlight is we are continuing to get the word out about some of the changes related to J&J. And so, again, chicago.gov/COVIDVax is where you can go to find information. This is a little small, but sorry about that, but it's larger on the website. And just as a reminder, to give you a sense of some of what's happening, you know, we've got 3 South Side mass vaccination sites that are open at this point. All 3 are using Pfizer. We have moved them all to Pfizer. Anybody who had an appointment at Chicago State that previously was Johnson & Johnson, you keep that exact same appointment. You don't need to do anything about it. You should still come, but you'll receive Pfizer instead of Johnson & Johnson. Similarly, Daly College and then Apostolic Faith Church in Bronzeville, which just opened this week. They are all using Pfizer, and access is prioritized for all of the highlighted zip codes here, really on the south side. Where we do not fill appointments, we then open appointments to the rest of the city. And that's really the approach that we've been using throughout here. We want to make sure that all vaccine is being used. As you see, we're good at that. But we do want to give some priority to some of the parts of the city that remain under-vaccinated. And so for the South Side, for example, priority first goes to people who live on the South Side for these 3 sites. And then we do post additional appointments if they don't fill on ZocDoc. And every day we are putting appointments on ZocDoc. In addition to, for example, these that are focused for the South Side. And you can see there are links, and you can find them on the website. Those are for people who live in the zip codes on the South Side, and there's more information. If you don't reside in one of those highlighted zip codes and you try to sign up with this code, you won't be able to complete the sign up. But once there are appointments on ZocDoc, they are available to anybody in the city of Chicago. We also have managed to work with the federal government to get the United Center sorted. So we can come out of the slideshow here and just talk a little bit more directly. But we're seeing some questions, already about United Center, and not surprisingly. So the federal government has agreed to switch our United Center allocation to Pfizer, which we are very appreciative of. As you may know, we were scheduled on Monday to switch to Johnson & Johnson there. Everybody who has an appointment from Monday on at the United Center can keep that appointment. You do not need to do a thing. You will just receive Pfizer instead of Johnson & Johnson. We are emailing everybody who used an email to sign up for an appointment at the United Center. We are calling the people who signed up through the call center or otherwise did not have an email address, just to let them know that the type of vaccine is changing, but the time of your appointment is not changing, and you do not need to do a thing. You show up at your scheduled time next week, really, and moving forward. We will also be posting. We had put a hold on additional signups at the United Center while we were waiting to see what happened with vaccine there. And so we will be posting additional United Center appointments on ZocDoc. I know there will be some going up over the weekend as well. So again, encourage people to use ZocDoc to look for some of the mass vaccination appointments here. And every day, again, there are appointments available. And if they're on ZocDoc, they're open to anybody who lives anywhere in the city of Chicago, regardless of the location. We also, working with partners, we're posting at the Wrigley Field mass vaccination site up on the north side that Advocate is operating. And then we've got providers all over the city that where they have availability, they are also putting appointments up on ZocDoc. So that remains your one-stop shop related to finding vaccine through some of the larger mass vaccination sites or through providers that are broadly open to the public. Also online, we've got the pharmacies, right? And all of the pharmacies are getting vaccine directly from the federal government. Not all of them, but Walgreens, CVS, Walmart, and Jewel are receiving vaccine directly from the federal government. And you have to go to their specific websites, but we've put some links up there to try to make it easier for you to use those sites. Our call center remains open. If you're having trouble figuring out how to book a vaccine, we can help with that, and we want to help with that. And I want to say that we are, it was a setback in terms of that J&J loss for sure, and we've had to work pretty hard to reschedule various pieces, but we are starting, with more vaccine coming in. I believe last week was the first week we were able to actually fill all of the vaccine requests that providers across the city put in. So all of the smaller practices, all of the hospitals, all of the independent pharmacies that requested vaccine, for the first time last week, we could fill all orders there in terms of getting vaccine out. Really exciting, because one of the challenges has been us just not having enough vaccine to be able to get it to all providers. Now, 78 of those providers had gotten Johnson & Johnson, and so in that setting, we've used some of the Moderna that's come in to instead get some Moderna to those outpatient practices. But I do want to remind you that the number one way still people are getting vaccinated in the city is through healthcare providers, through hospitals, through pharmacies, through clinics, through federally qualified health centers, and then we are of course filling in other ways. Also, our Faith Month initiative is continuing in partnership with Walgreens. So over the month of April, there are approximately 70 houses of worship of different types that have vaccine-related events that are, we're not in 70 locations, but they're grouped, and there's been specific outreach through 70 different congregations. But there are a lot of sites, and so again, there's details online. But this coming weekend on the 17th, so that would be Saturday, Salem Baptist Church at 752 East 114th Street, Grace and Peace Church at 1856 North LeClaire, St. Catherine Drexel at 9015 South Harper. Oh, I'm sorry. Those first two were for April 17, and then the next weekend, April 24th, we have St. Catherine Drexel at 9015 South Harper, St. Ferdinand at 5900 West Barry, and then one more, April 17th, Our Lady of Guadalupe Church at 3200 East 91st Street. There are that one I know is already full, so congratulations to Our Lady of Guadalupe Church that has had basically all 500 of its appointments already booked, but I know that there remains some open appointments at all of the rest of them. So there is more information available, particularly if you are connected with one of those congregations, or if you live in the neighborhood near there. That's where we're most interested. And we're working, as vaccine supply is starting to open up a little bit, we'll be sharing some more of this out more publicly to ensure that more people are going to be able to get vaccine. And one of the things that I'm really excited about is, as we open up on Monday to having vaccine eligibility for everybody over the age of 16, one reminder, 16 and 17-year-olds can only get the Pfizer vaccine. They are not authorized for the Moderna vaccine. That's because the trials were not done in 16 and 17-year-olds related to Moderna. It does not have anything, no concerns about safety. It's just that that's not who the trials were done in. And so the Pfizer vaccine, as a reminder, is the one that is quite a bit more complicated. It's the one that requires the ultra cold storage. It's the one that you only have 5 days to use it after you pull it out of ultra cold storage, whereas Moderna, you have 30 days and you only need a freezer, not ultra cold. So most of our regular outpatient practices and a lot of our community events, really that Moderna vaccine is the one that makes the most sense in a clinic setting. And it's more of our hospitals and then some of the larger mass vaccination sites that the city and our partners are sponsoring is where the Pfizer tends to be. So we'll be talking some more about access for 16 and 17-year-olds, but know that we are already making it and working with some of the hospitals, and we will be expanding additional opportunities for 16 and 17-year-olds to be able to be vaccinated, and more about that, in the days and weeks to come. But I don't think we're that long from this starting to feel a little more like a flu campaign than a COVID campaign. Not next week, not the week after, but I think by late April into May, I think it will increasingly become easier for people to be able to receive a COVID vaccine. And I've been excited to know that that's coming, and appreciative of some of, Indiana, for example, already at a point where they were having trouble using up all their vaccine, opening to Indiana residents and a lot of Chicagoans who have had the means to travel to places where there is more vaccine that is not being used. People who have traveled outside Chicago and have had the means to do so. I want to thank you for doing that, because you getting vaccinated outside Chicago does leave us more vaccine to be able to get it to folks who maybe don't have the means. And given that we've vaccinated a lot of non-Chicagoans, it helps us also make sure that we can be as covered as possible. So thank you to everybody who has opened up that eligibility. And I want to really, give a appreciation to the state for recognizing that, especially in the setting of the J&J shortage and having vaccine that is really just not going to use in some parts of the state, directing some vaccine to Chicago that that is important, and I hope that that is something, you know, we continue to collaborate on, because it's in everybody's best interest, of course, to get everybody as vaccinated as possible, and our demand really does remain very high at this point. So I said right at the outset when we moved into 1C that I expected most of the people in 1C would be able to be vaccinated in April or in May, and I do expect that that will be true. Okay, so some more questions here, and I was trying to kind of hit on some of them. Sharish Bradford, for those who were scheduled to take the J&J vaccine, what are the alternatives? So in the great majority of cases, we have moved those to Pfizer, or if it was with a provider, we're working to get Moderna to some of those providers, so they should be able to switch that over. There were a couple of the kind of employer-based sites that we still have on hold while we're waiting for some more vaccine to come in next week, but that would be communicated through your employer. If you had an appointment, though, at a Chicago-run site or at a Cook County-run site, those have been switched over to Pfizer at this time, and you don't need to change anything. You just need to come on time for your appointment, and we will get the second dose of the appointment to you on time. Mark Kunkel, does it mean there will be a vaccine shortage at the United Center? No. We are getting from the feds, and again, this is really a note to the fact that we've had really good uptake and really good demand at the United Center. Our appointments go like this. We've had good equity data there too, where we've had a lot of folks, particularly in some of the heavily Latinx areas near the United Center, and a lot of folks from, you know, a lot of, it's been a good mix. We've had a lot of Asian Americans, we've had a lot of African Americans, we've had a lot of Latinx folks, all getting vaccinated at the United Center. And so the federal government has committed to fulfilling the full allocation, just switching it over to Pfizer. And no changes related to walk-up, drive-through, et cetera. You would no changes. If you were getting your second dose of Pfizer, you will get your second dose of Pfizer on time. If you were scheduled from next week to get a first dose of Johnson & Johnson, instead you will get a first dose of Pfizer, and you will get scheduled for a second dose of Pfizer on time at the same place where you got your first dose. That is always our best practice. It continues to be our practice, so no worries about that. Okay, let's see. So some questions about children here. What is the current status of vaccine trials? This is Tiffany Hagstrom. What is the current status of vaccine trials for children 6 and up? When do we expect to see data? And Taryn Kurth is asking, what is the estimated timetable for the decision on the Pfizer vaccine for 12 to 15-year-olds? Okay, so Taryn first. So Pfizer has submitted information from its 12 to 15-year-old trial to the FDA, and that is where it is sitting right now. I don't know for sure how long the FDA is going to take to do that full review. Because the vaccine is already under emergency use authorization, it doesn't need a new emergency use authorization. It just needs an amendment to the existing one, so that will probably cut some time out of it. The ACIP, the CDC group that makes the recommendations for vaccinations, will also weigh in on that. I don't know the timetable for that. Certainly with the attention on Johnson & Johnson, the ACIP is very focused on making sure that that is addressed first, I'm sure. I continue to expect that we may see Pfizer approved for adolescents, meaning that 12 to 15-year-old group, in addition to the 16 and 17-year-old that's already approved. I'm saying sort of by the summer. I think it could be as soon as May into June, but I just don't know. And the FDA has not given a lot of signal yet about the timing. The data on that looked fantastic, and it's possible that they could move sooner. So we'll let you know whenever we hear more about that. We are planning already for being able to stand up vaccination for 12 to 17-year-olds. Because it is the Pfizer vaccine, again, it is a little more complicated because we can't just send it to pediatricians' offices and have them put it in the freezer. It is the one that is more difficult, but we'll figure it out. CPS parent on Twitter, when can 16 plus get vaccinated in Chicago? As of Monday, they can get vaccinated in Chicago. any of our partners, any of our, again, most of this is going to be through hospitals. The city of Chicago pods themselves right now remain limited to those over the age of 18. That's partly because of parental consent issues, partly because we still have we have a long way to go among our higher risk groups. We are at this point, 62% of those over 65 have gotten a first dose in Chicago, and 48% of those over 65 have gotten 2 doses, which is not good enough. I want to be honest about that. I'm really happy with all of the rest of our data here in Chicago related to vaccination. 47% of Chicago adults over the age of 18 have already gotten a first dose. We will pass half of Chicago adults having gotten at least a first dose within a week here, and 27% are fully vaccinated. We're making really good progress, but that 65 plus group remains a concern. We are under vaccinated there compared to other settings. We're doing well on the race ethnicity data. There's still work to go there, particularly among African Americans, and we can look at details on that if you're interested. But we are really outpacing other jurisdictions in terms of progress there. But we are keeping, one of the reasons for this Faith Month, et cetera, is continued concern about getting our older folks vaccinated. So we'll be doing some more focused, and you'll hear more about this, some more focused work for 16 and 17-year-olds, but it will probably be separate from the larger pods because there's just some different things that need to happen. But yes, as of Monday, eligible, and there will be, and there are lots of opportunities for children 16 and 17. We'll make sure there's data on the website that's clear about that. But please, if you've got a 16 or 17-year-old, you need to go with them to that appointment. They can't just show up and get vaccinated. Belinda Jackson on Facebook: I received my second dose of the Pfizer vaccine on January 30. Will I have to have a booster shot next January or before? Not based on what we know now. To be really clear, right now there is no recommendation for a booster shot, and the Pfizer vaccine, the Moderna vaccine, both have continued to show very high levels of protection for as long as the trials have been going, which is now more than 6 months. So there was some news a couple of weeks ago showing that both in Pfizer and Moderna, number one, they were extraordinarily protective in the real world, not just in the trial, more than 90% protective, really amazing outcome there, but also that the antibody levels, the protection levels had not tapered off. They had remained really good and high. So we have no reason at this point to expect that you would need a booster dose at any particular point. That said, we've been following for 6 months. We're going to continue to follow, and if we were to see immunity really fall off, that could be a reason for a booster dose. But the more likely thing would be if we saw a new variant emerge and really take hold that the current vaccinations were not protective against. All 3 of the vaccines that have been in use in the US are protective against all of the known variants. It's just that with some of them, the level of protection drops. So maybe it goes from a 90% plus protective to more of like a 70% protective. But if we were to see more emergence of variants, it's possible that they could need to make a vaccine to protect against that variant that could be a booster. But that is all theoretical. As of right now, I certainly am not planning for a booster shot myself. But I know that given COVID is unlikely to be in control around the world by January of next year, there may be the potential for emergence of variants. The best thing that you can do is get vaccinated as soon as you can right now, because that limits your risk right now, which limits the risk of variants spreading and helps stop the emergence of new variants at the same time. Joyce Carrasquillo on Facebook: should you not take a pain medication in the week before taking your vaccine? So I always recommend that people take pain medications, if they're having severe pain, and I wouldn't want, especially if somebody is having a lot of pain, that you need to take certainly a prescribed medication, or if you need to take a Tylenol or an ibuprofen, you can definitely do that. The only thing we recommend is not to take a proactive acetaminophen, a Tylenol or an ibuprofen, because you're worried about reaction to a vaccine. So if at any point you're having a lot of pain, you should take the pain medicine like you always would. There's always a little bit of this theoretical risk. I think this is what the question is getting at, that particularly if painkillers tamp down a little bit the immune response, would that impact the vaccine? Really, when this has been studied in children with other vaccines, for example, we've not seen a lot of evidence that this in any way makes the vaccines not effective. So it's more of a theoretical risk. My recommendation to my patients is that don't take a medicine in advance of getting the vaccine just because you're getting the vaccine. But if you're having a lot of pain and you would otherwise take the medicine, take the medicine. And then after you get the vaccine, say you have a really sore arm, like where you would normally take a painkiller, you can also take a painkiller in that setting. So that is my advice on that. Cara Marie Blaine from Facebook. Why aren't there more vaccines in the city? Lots of people having to travel to get the vaccine. Boy, Cara, I hear you on that. This has been really the story of the last few months. We have an extraordinarily efficient vaccine operation here. As I showed, every single week, all the vaccine that's been getting here has been getting out. But vaccine is allocated based on population, and specifically based on people who live in the jurisdiction. So the city of Chicago directly receives vaccine from the federal government, and we receive it based on the number of people who live in the city of Chicago. However, so much of the vaccination efforts have been through employers and through healthcare providers. And in both of those settings, there are a lot of non-Chicagoans who either work or get medical care in the city of Chicago. And we felt really strongly, it's absolutely a best practice in public health, that if you are doing employer-based vaccination, you should offer, especially in phase 1B, when you're in there because there's a higher risk, people are essential workers, et cetera, you definitely want to offer everybody in that employment setting vaccine at the same time. So we don't look to make sure do people live in the city. And then secondly, particularly where people are getting their medical care, that is by far the best place for you to get a vaccine. You have the opportunity to ask your questions. The person who is giving the vaccine knows your medical history, can talk to you about bringing in your friends and family. If you've got questions like, should you take a painkiller, right? It's the perfect setting for you to be able to get the vaccine. It's the #1 place we want people to get vaccinated, and it helps keep people connected to their primary care provider, which is good for all sorts of other reasons that have to do with their health. And so if people get medical care in the city of Chicago, regardless of where they live, we've said, yes, please get your vaccine through your provider. So all of that has meant that about 1/3 of the vaccine that Chicago has received, it's about 35%, has gone to non-Chicagoans who, for the most part, work in Chicago or who get medical care in Chicago. And that has left us a little bit behind, if you know what I mean, in terms of getting Chicagoans vaccinated. It's the right thing to do for public health, but that's why we've been really pushing on both the federal and the state to help make that up. I appreciate Chicagoans very much, like I said, who have been willing to travel. I know that is harder. Some of my own family and friends have gone to Indiana and have gone to downstate Illinois. And it's in everybody's best interest, of course, to use all the vaccine that is available, because if any part of the state or of the region is having a surge in cases like we are seeing here, that has the ability to impact the whole region. And I'm really worried about what's happening in Michigan. And so, Indiana, recognizing that it had a lot of vaccine available and inviting people from Michigan and from Illinois to come in, I think is a really good example of that. As we moved into phase 1C, we did make a decision to help make sure that we can get vaccine to our most vulnerable settings and get it to Chicagoans that For our mass vaccination sites, right now they are only open to Chicago residents, and that's something that we're going to maintain for now. But through healthcare providers and when we're doing strike team employer-based, we continue to vaccinate anybody in those settings because it's the right thing to do. And that is my very long answer to why that is. I've been really asking, and this has been a conversation at the national level. I'm hopeful that as we move ahead, already I'm feeling a little bit of like I said, last week was the first time we could send vaccine to all the providers who wanted it. We're starting to feel that there is some more vaccine availability in that supply-demand curve, and I think it's going to feel better and better each week, even with the Johnson & Johnson setback. But I know that there are still a lot of you who haven't been able to get vaccine yet. And please rest assured in what I said right from the get-go, that in April and May, I expect you'll be able to get a vaccine. I really mean that. And we're doing everything we can to bring vaccine closer and closer to people's homes, and especially through providers. G. Wilma Rodriguez from Facebook, is the city planning mobile vaccination trucks into food or transportation desert areas, especially for the elderly? Go to them instead of the other way. Yeah, absolutely we are. And the pilot program that started with this was our vaccine bus, where we have decked out some of our CTA buses, and thanks to CTA so much for this partnership, pulled out some of the seats, put in some tables, really set up the ability to have a vaccination clinic on the bus. And then the idea is these buses can travel along the bus routes in some of the least vaccinated areas. We're not going to vaccinate anybody while the bus is moving, don't worry. But this idea that you might park the bus near a senior center or near a shopping center, and people wouldn't need to need an appointment, but would be able to come and get vaccinated. We're excited about efforts like that. Those really do work the best with a single dose vaccine like Johnson & Johnson, where people can decide on the spot to get vaccinated, not need to do the registration and the second dose piece. So we're waiting a little bit to hear what happens with that, but that is definitely one approach. And the other thing, and I see some questions here about homebound, we have decided, that's the ultimate example of bringing vaccine, to people's homes who are unable to leave to get vaccinated. And we have had about 5,000 people register for that program. That was a program that was using Johnson & Johnson. We have made the decision to move that program also over to Pfizer, at least for the short term, because I feel, really from an equity standpoint, we think it's important to get vaccine out, even though it will mean twice the number of appointments. And so we are continuing to ramp that program up. The call center has called people who had to be scheduled for J&J, and from tomorrow, we will again be running that homebound program, but now with Pfizer. If J&J comes back, I am hopeful that once the analysis is done, we will get some further guidance on Johnson & Johnson. I think that would likely be a good setting to continue to use it, but I didn't want to wait. And for now, we are moving ahead with Pfizer in that setting. And as we have more vaccine, we will have even more ability to do these kind of very neighborhood-focused events, more like we do for flu clinics. Right now, it's so important that we're operating these larger mass vaccination centers where you can get, hundreds or thousands of people through, because we have such a lot of people still to vaccinate. That efficiency piece is especially important. As the supply goes up and the demand goes down a little bit, we actually do shift a lot of our approaches to more of this neighborhood-based, smaller efforts, and being able to be through the second doses, right? My teams are out right now doing the second doses for all of the senior facilities, and we're doing the low-income housing facilities, and we're doing a lot of the employment settings, and getting sort of through those operationally, opens us up to be able to do more of those kind of smaller events that may be a little less efficient, but very important in terms of lowering barriers for people for whom transportation is a challenge. So you'll be hearing more about it. We're excited as we have more vaccine to be able to do more of that. And certainly the aldermen, I know, are very excited about being able to do more of those kinds of events in neighborhoods. And it's going to mark a different phase when no longer is it, the Hunger Games feeling of can I get a vaccine? It's about people who maybe did not either raise their hand first or who had barriers to being able to get that vaccine right away. We'll be switching to more of those very hyper-local focused approaches. And that's really what our vaccination effort will look like more over the summer with a lot of focus on children as well. Which reminds me, I forgot to answer, we are out of time, but I forgot to answer the question about what do we know about the younger children's vaccine. So there has not been any data yet back from any other trials on children. Pfizer 12 to 15 is the only trial data that we've yet seen. So there are adolescent trials that are running for Moderna, which are going to be really important because I would love to have Moderna approved for adolescents because that's the vaccine that is much more easily used in the outpatient setting, meaning we could use it in school-based clinics and we could use it in regular pediatricians' offices. And so I'm really hopeful that that will also come through from an operational standpoint. And but the younger than that, we are very much still waiting on data. There are trials that have started for younger children, and if I had to take a guess, I think this summer we will be vaccinating children 12 to 17. I would expect by the end of the year we'll be vaccinating children maybe 6 to 17, and then I would guess perhaps early 2022 we might be vaccinating, from 6 months to 17. That is a guess, though. That is all dependent on how, of course, the trials go. We've got to make sure there's good safety. We've got to make sure there's good efficacy. We've got to make sure the dosing's right. There's a lot of work to do there, and we'll keep you updated as that goes. But right now, getting adults vaccinated is the most important thing that you can do in terms of protecting children. So thank you, everybody who wrote in with your questions. If we didn't get to you, we will be back on Tuesday, and we will, when we don't get to your questions, we try to get them onto the website. So I refer you, as always, to chi.gov/COVIDvax, where we update that thing every single day with information about where you can find vaccine, try to get your questions answered. So just, I think, we already laid out some of the faith events that are happening this weekend, which is certainly some good news. And just I want to give a big thank you to everybody, both on the Chicago Department of Public Health team, but really all of our providers across the city who are doing an amazing job getting all of this vaccine into arms, doing it in a way that is efficient, as equitable as possible, and reducing barriers. I think I'll just end on, in terms of a good news story. People may have seen this in the news about Northwestern University up in Evanston. Last Saturday night, we had a little bit of a situation where there was a provider, not one of the city clinics, but one of our providers who was using Pfizer vaccine. And remember, to the point, Pfizer has to be used within 5 days, and they had some miscalculation related to how many doses they expected to use, and I think had not entirely realized that their vaccine was going to expire at 7 a.m. on Sunday morning. And by the time they called the health department, they called us, it was already pretty late in the day on Saturday. And let me tell you, Saturday night is not a good time to try to figure out how to use 200 doses of vaccine. But my team and really people across the city are so committed to not wasting vaccine. We have great plans in place, and we expect people to have 4, 5, 6, 10 doses at the end of a clinic, and we've got plans for that. But 200 doses is never something that we want to waste. And so we've got a skeleton team on over the weekends, and they pulled in people. We had a lot of folks calling around, to hospitals and emergency departments and clinics and schools and universities saying, can you take this vaccine tonight? Can you use this vaccine before 7 a.m.? If it had had a 9 a.m. expiration date the next day, we could have used it, which is why really if clinics have a concern that they might not use it within the 5 days, typically we'll take it back and exchange it out. But there was just some, a little bit of miscommunication there. And we were glad that they called when they did. And honestly, we had almost given up. And, I had said, we've tried really hard. But we're under no circumstance are we going to give a vaccine that is outside of that 5-day window. And we had said, unless we really get something sorted in the next half hour, unfortunately, we'll have to waste that vaccine. And then Northwestern University, which isn't even in Chicago, which tells you how far we were sort of calling, said, you know what, we'll figure this out and get it done. The team brought the vaccine up to Northwestern, and I have to give them huge props. They pulled in a team of about 13 people, people from their health center, athletic trainers, some of the student life people, and set up and sent an email, this is all Saturday night, to the kids, sort of saying, welcome to sign up for vaccines starting at midnight, and got 200 people vaccinated between midnight and 2 a.m. And I just can't say enough about the willingness of Northwestern and really of all the folks behind the scenes around transportation saying, we are not going to let 200 doses of vaccine go to waste. I don't care if there are, hundreds of doses sitting other places, we're going to make it happen. And, huge shout out really for all the problem solving and the doctors who came in, with families between midnight and 2 a.m. to get those kids vaccinated. We'll get them second doses. But really, people continue to step up every day in ways that make me really happy across Chicago. So thanks for everything. A little bit of patience, please, still. If you haven't been able to get a vaccine, keep checking with your provider, keep checking ZocDoc, keep checking the pharmacy websites. There are appointments going up every day there. If you have the opportunity, there is vaccine available outside Chicago. You're eligible there, and we will get everybody vaccinated and keep making progress. Thanks so much. We'll be back on Tuesday.